The Ministry of Health is in another turbulent wave of panic now that new data entries indicates a surge in new positive COVID-19 cases since last week. Minister of State in charge of primary health care, Joyce Moriku, says this is signaling the second wave of the pandemic.
Uganda has entered into phase 2 of the coronavirus. We are seeing cases going up from last week. Cases are climbing up. Our graph is no longer going to be flattened. Our graph is gradually rising and rising and rising.
What is more worrying, variants from other countries like South Africa and United Kingdom have been detected in Uganda.
The variant that is from South Africa, the variant that is from United Kingdom is already in Uganda. And this type of variants, they really spread like a bushfire, and they're very aggressive. So that is why we need to take a lot of precaution. As a country, we've put a strong surveillance system in place.
The public has therefore been encouraged to strictly observe COVID-19 preventive measures alongside the ongoing vaccination exercise.
In doing all this, we are still advised to socially keep distance, keep your face mask every time, and hand hygiene, because we are not yet over.
As government prepares for other tough measures, not excluding partial lockdowns in some regions if necessary, government has dismissed reports that it has not permitted private hospitals to procure COVID-19 vaccines for sale.
The message is clear and loud. Any private sector that will wish to import COVID vaccines has to apply to the Director General. And it has to be very clear which type of vaccine are you importing, from which company, where are you going to sell it. Otherwise, these vaccines are not to be sold. They are to be given free of charge to the people. So far, we have no private sector that has imported any vaccine. And we are going to be very strict.
In the last 2 months, the country recorded a decline in the number of COVID-19 cases, but since last week, a rise has been recorded. Adiana Kute, UBC.